Every last Inuk across this country has a connection with suicide. We all have lost family members and friends, just important people in our community.
Inuit Tapirit Kanatimi President Nathan Obed knows what it feels like. In the Labrador-Grenfell Health region, the number of suicides more than doubled from 2020 to 2021, from 9 to 19. Suicides also increased in the Eastern Health region, while they went down in Western and Central. Overall, provincial numbers increased by about 25%, from 65 in 2020 to 81 in 2021. Troubling, says progressive conservative health critic Paul Dinn. He's calling for improved access to long-term mental health care.
When you're hearing of people who are waiting 24 months to see a psychiatrist, that will tell you when you go to get looked at for a mental health crisis and you're sent away probably with a brochure or an online website to go to, or give us a call whenever, that doesn't go over.
Health Minister Tom Osborne attributes the recent rise in suicide numbers to the COVID pandemic and says strides have been made.
Wait times for mental health services has been improved significantly in the province. Bridge the Gap has been very successful and adopted throughout the country. We now need to, work on getting the numbers reduced again.
But one Memorial University professor who has researched suicide for years says it's not as easy as connecting suicides and the pandemic.
I think COVID is part of the picture, but at an individual level, we haven't looked, and so it's hard to say whether or not, a specific person died or didn't die because of COVID, and that's, a real simplification.
He says slight changes in suicide rates are expected from one year to another, and that sometimes the overall rate is skewed by an increase in one region.
You see these spikes in the numbers, and in some instances that's not part of a general trend in the province overall, but that's really specific to a place.
One suicide prevention advocate agrees the 2021 numbers don't point to a crisis.
The thing about suicide and the number of suicide deaths is that it does vary from year to year. It goes up and down and up and down and up and down. 25% isn't... It isn't out of the ordinary. There are some years it's 60, some years it's 92. It just depends.
Davies comes from a point of experience. Her son Richard ended his life in 1995.
To me, there's nothing worse than losing a child to suicide. The thing that I take out of that is that that's the worst thing that's ever going to happen to me.
Davies also worked on Our Path of Resilience, the provincial government's 5-year suicide prevention plan, which was launched in June and aims to address existing gaps in the provincial system to ensure a reduction in the number of suicides. Henrike Wilhelm, CBC News, St. John's.